Hi everybody, welcome to Chapter 5.3. Today we're going to be looking at policy and practice relating to old public health and looking at the contribution of public health measures to improvements in Australia's health status. Our key concept for today is being able to understand policies and practices that relate to old public health and looking at other public health measures and how they've contributed to improving Australia's health status. We're going to be looking at a number of different areas today. We're going to be looking at the concept of public health and looking at the old public health definition. We're also going to be looking at the improvement in Australia's health status throughout time. This includes things such as the discovery of vaccines, the role of the Commonwealth Government, and also the shift to health promotion. I would like to remind you as well to please document anything that's in green word for word and anything in white into your own understanding. So let's begin. So we firstly look at public health. So public health is concerned with the organisation and collective effort to improve the health status of the entire population. This basically refers to the ways in which governments monitor, regulate and promote health status and prevent diseases from occurring. There are a number of ways in which the government can advocate this through creating legislation and policies that centre around health promotion. So these sort of policies and legislation can include things like food safety policies for businesses and hospitality, immunisation and vaccine promotion for young children, and gathering population health statistics through obtaining statistical data on health status and look at improving health and well-being overall for the nation. So now we turn our attention to old public health. So bacteria was found to be the main cause of disease and death early in the 20th century. During that period of time, the poor living conditions in which the population lived resulted in pressures being placed on the government to address the high rates of infectious diseases that were main causes of death and disability during that time. This made the government invest in water and sewage systems to improve the sanitation, so improving water conditions and living conditions for people to live in, improving nutrition, improving housing conditions, and in working conditions overall for people to work in. These public health actions, due to focusing on the physical environment, became known as old public health. Overall, it contributed to the reduction in deaths from infectious diseases such as diarrhea in children, but it also meant that improving housing conditions and improving nutrition led to a reduction in respiratory diseases such as influenza, and also meant that people had better established immune systems and were better off fighting off diseases, or therefore their body was able to recover more quickly from them. These actions brought about improvements in life expectancy and infant mortality rates during the early 20th century. So now we'll focus on improvements in health. So we'll focus firstly on the discovery of vaccines. So vaccines were introduced to remove the threat of communicable diseases and reduce the morbidity and mortality rates caused by disease. It was firstly made throughout the 1930s to eradicate things such as diphtheria, the 1950s for tetanus, and the 1960s then for measles. So the overall success assisted a lot of countries in eliminating smallpox and eradicate polio in most countries as well. It also meant that vaccines were introduced at a much younger age to ensure that children weren't obtaining any of these diseases throughout a young age. So now we focus our attention on the role of the Commonwealth Government. So quarantine laws were established by the Commonwealth to assist in preventing the spread of disease. This was introduced following World War I to address the high mortality and morbidity rates caused by tuberculosis and other venereal diseases that were occurring throughout that time. It was also during that period that following World War I, research facilities were developed to assist gaining information about diseases. Through gaining more information, we developed a further understanding on vaccines and the promotion of vaccines and in how our body can fight off infectious diseases more regularly. Finally, we look at the shift to health promotion. So health promotion campaigns were introduced to assist in reducing and building education on lifestyle diseases. This was first introduced throughout the 1950s and 60s. The reason being was because they were designed to bring about individual behaviour change by making people aware of the causes of ill health such as things like tobacco smoking, poor diet, physical inactivity, and also excessive alcohol consumption. This also meant that there was a reduction in morbidity and mortality rates overall for the nation. Mainly, motor vehicle accidents were the main thing that were promoted throughout the 1970s through the compulsory use of seatbelts, lower speed limits, better road, and as well as better car design and safety. So thanks for watching. Please feel free to leave me any feedback to improve these videos as we go along. Could you please complete activity 5.3 on page 173, questions 1 to 6. Thanks guys, I'm sure I'll see you soon. Please feel free to send me a message if you do need any further clarification. Have a great day.